This is the third in the videos where I get into Johns Hopkins research report. First two gave you most of the new things about the heart attack prevention. This one's going to continue that a bit, but I'm going to give you some new things, but a bit of a summary to kind of close it out. I'm going to try to put these three videos on this Johns Hopkins research in a row on my Facebook page. They may get out of order and I may not have a lot of say in that, I don't know. But I hope that you will want to follow along. To start out with, there are some frequently prescribed medications for heart attack prevention or whatever. Well, of course, you know I'm not a doctor. I've done a lot of studies on these. I have, to this point, had a really good heart. And in case you didn't catch it the last video or two, I just turned 80. And I think that's pretty good for having such a great heart. And I've had it checked out in numerous ways recently, so it's not just me saying that I feel good about it, it's the doctor's reports. But I can't give you the prescribed medications other than just telling you what they are a bit. Because obviously to do so if not being a doctor would be bad, maybe bordering on illegal, I don't know. But anyway, there's 5 most frequently prescribed blood pressure medications that will help prevent heart attacks. Now, this is blood pressure preventions. First of all is a diuretic. They're sometimes referred to as water pills. They reduce blood pressure by increasing sodium excreted in the urine. Promotes water loss, decreases blood volume, and lowers blood pressure. The second one is beta blockers. These are inferred with the action of hormone adrenalins. They lower blood pressure by slowing heart rate and decreasing the amount of blood pumped by the heart. So, usually when you get lab reports and they do certain kinds of things at the doctor's office, they also get your heart rate. And if it's too high, it can be of concern. Some of the athletes, when they're in good shape, maybe even doing some exercises, will get in between 60 and 70 for a heart rate. And many times when I had gotten mine done, mine was pretty much 70. I had not done any heart exercises, anything before that as well. The third one is ACE inhibitors. They decrease blood pressure by blocking the formation of enzymes that produce angiotensions. And this angiotension constricts blood pressure or blood vessels and stimulates the adrenaline glands to release a hormone called aldosterone that promotes sodium retention. So, ACE inhibitors reduce the levels of the angiotensions. I may not be saying that right, sorry. I'll spell it for you. angiotensin. The fourth one is the blocker to that angiotensin. And they work by interfering with the action of the angiotensin and preventing its negative effects on the heart and blood pressure. These drugs not only lower blood pressure, but also protect the heart. Finally, there's the calcium channel blockers. They lower blood pressure by preventing calcium from moving into the heart and blood valves, which dilate the coronary arteries and decrease the amount of blood pumped by the heart. Like beta blockers, these medications help alleviate symptoms of angina or the pain in the heart. They reduce the strokes and kidney disease. And I want to say one thing. When I was 18 or 19, I had a kidney stone. And they said that the doctor, still remember his name, Dr. Adney, I suspect since it's been so many years ago, he's passed away by now. He restricted my intake of calcium. And so when I was about to be drafted and I signed up for the Air Force, and I spent 6 years committed to the Air Force, 2 in reserves, 4 active, I had to have him give me a note that said to anyone, sergeant, lieutenant, captain, whoever might have been in charge of me for a period of time when I was in training, that kept saying, well, you need to eat more, drink more milk, or do this or that and the other. I could pull this out and say, hey, here's my problem. And if I do that, I'll probably have a kidney stone and I will have to be released from the Air Force. And I didn't want to do that. I wanted to serve my time. It's a good time, by the way. So anyway, I did pass the kidney stone when I was just barely 19, I think. And I've reduced my calcium intake throughout my years. And I just told you my age. And I've not had a problem since. And I didn't have to take the channel blockers. I just reduced the calcium intake. Now there's things we can do on our own, isn't there? Well, these are the things that will prevent blood pressure from being too high. And just knowing them and what they do, a little bit about them. When you go into a doctor and he says, hey, you're on the borderline, or I need to prescribe one of these, you have a little bit of information. Always helpful to know a little more. Second area that I want to mention is, I said much about this in video 2, but it's kind of a good summary. First of all, the ABCs of heart attack prevention. Some doctors will prescribe a daily low-dose aspirin. Don't do it on your own, but if you do, make sure you take it. It's a dose usually of 325 milligrams. That's what's recommended. Again, wait till your doctor tells you you need to do this. And you need to keep your blood pressure below 140/90. Now, recently, we found out that that may be a bit high and maybe something you might keep lower than that. The new rate, the ideal rate, is 120/80. And to make sure that it's at least 130/80. The third one is total cholesterol. It should be below 200 milligrams. And you should keep your bad cholesterol, your LDL, under 160. My rates for my good have been lower than they probably should be, 155 for a lot of times. So I could do something to increase mine if I wanted to. My bad ones were below that 130, like 115 to 125, something like that. But it was something that I should probably watch and keep my lower or bad cholesterol below. And constantly watch that. Well, I do that by having my 6 to 8, 9 month checkups every year. Then you need to keep your diet and your weight control. You can do that with a variety of fruits, vegetables, whole grains, low-fat diet, dairy, fish, beans, poultry, and less meat. Doesn't mean no meat, just means less meat. 70% of your total sorry, 7% of your total calories should be trans fat or less. Now, it's kind of hard to know how much 7% is, so you kind of have to watch some of the labels and see what they say. Then the next one is exercise. Do at least 30 minutes of moderate intensity or physical activity, such as brisk walking on 5 days per week. Exercising for long periods is even better for weight loss. Well, I don't have to have exercise for weight loss. I recently, when I had my cancer operation, a mass on my pancreas, where they removed a little bit of my intestine, a little bit of the liver, and a little bit of the pancreas, put them all back together, and it was called a whoopee surgery. And I had 32 clamps in my stomach area. I've done extremely well since then. Had 10 bouts in 21 weeks of chemo. Hardly any problems with that. A little bit of weakness, a little bit of equilibrium. I still walk with a cane. I just got back from doing 30 minutes outside in the neighborhood with my cane, walking pretty briskly. So I got my exercise today. I do that to strengthen my muscles, not to weight loss, because again, I lost 60 pounds. I don't need to lose any more weight. In fact, I'm now eating a few things that I probably shouldn't from a dietary standpoint, but I've been told by my doctor to gain some weight and don't be so concerned about your calorie intake for a while. Finally, one of the things that I know that you know, if you smoke, stop. Stop completely. And if you have diabetes, strive for the best possible control of blood glucose level. Now, my glucose level, the last reading that I had, was marginally high. Nothing to be concerned about, he said, but just marginally to watch it and to treat it. A lot of times you'll get indications on your blood test that you're getting into pre-diabetics. So keeping your blood glucose level below 100 is what you try to do. Mine, I think, was about 107 last time. Again, nothing to really be concerned about, but something I need to watch a little bit. Now, overall, after my surgery, cancer being removed, great time with my chemo, and because of this virus that's going around the country, as I record this, I'm not going into areas where I could be around a lot of people, and so I'm not considering doing any radiation. And both the radiation doctor and the oncologist said, because I have such good reports, it was entirely up to me. They weren't recommending it one way or the other. They wouldn't stand in the way if I wanted to do it. So I'm going to wait 3 months for my last consultation with both of the doctors, which has been about a month ago, and do another CT scan. Maybe I'll wait a little longer, see how the virus is affecting things, and then I may say, okay, if there's any kind of certainly increase in the normal rate of the cancer marker, then I may do radiation. Now, this is totally outside the scope of this video, heart attack prevention, but it is something that takes you through and help you understand your total health, and that's really what I'm trying to do here, is total health. So there are some things in screening that you can do for heart attack risks. So if you go to your doctor and he says, you know, we need to do some screening here because you've got some symptoms that are either in the range where we just need to consider doing something more, or they're on borderline or just slightly low but borderline and you might want to do some things. Well, here's some things that they may do, and you just need to understand what they are and whether you want to have any knowledge of them before you go into the doctor's office. It's entirely up to you. But I wanted to make this a pretty complete picture in these 3 videos. So if you're in the borderline or have just recently found out you've got some heart problems, you're going to have more information, and you're not relying on going on the internet and having people tell you what is. Now, some of the information on the internet is valid, no question. But when you get a study like John Hopkins, or ones that I've got on the Cleveland or Mayo Clinic, or a couple of others, and I'm going to tell you about what some good ones are in a moment to finish the video, you can get some good information from researchers and not rely on somebody putting something on a video that may or may not be good. So you can have a lipid profile at least once every 5 years. It determines your blood level. And again, it talks about your good, your bad cholesterol, but also your triglycerides. I've had that done. Then there's an electrocardiogram. I had that done before my surgery in my pancreas. It was really good. They did it twice and they said, hey, for your age, I can't believe that this is so good. Now, remember I said I actually credited that to 2 factors. One, people will talk about your hereditary. And there's certainly one that you can't control, and it's a big one. Well, my father passed away of heart disease when he was 62. I'm already 18 years past that. Maybe my hereditary wasn't so good. But the other one, I think, was the real main cause. It was my vitamin regimen. Go back to video 2 and you find out some of the things that I did. I don't want to repeat it right here again. Another one is your exercise stress test. I did those, and it was all good. I had one young lady, and she says, wait a minute, I need to see about doing that again. I don't think that's right. I said, wow, what's the bad one? She says, no, it's so low. I said, good. Another one is other kinds of stress tests. A nuclear medicine stress test. Starts off with a regular exercise, but once you reach a maximum level of exercise or a treadmill or bicycle, you have something injected into your vein. Well, I never did that one. Never felt like I needed to do that one. Well, you might even consider a coronary calcium scan. Didn't need to do that. My calcium level had been low because of my kidney deposit when I was 18 or 19. So they do a scan. And I've had 3 scans, and my level of calcium was below the level. But I didn't do what was called a total calcium scan. It was just a CD scan, excuse me. And then, of course, they can do looking at an EBCT, which is coronary calcium scan which involves radiation exposure. That's probably what I'm going to be doing in 3 to 6 months, actually 2 to 5 months from now is probably what it'll be. And then there's a coronary angiographic. And I had one of those, and mine was fine. There are a lot of other tests to consider. A C-reactive protein, a protein called a CRP. There's a homocysteine, a PLCT test, and maybe some other scans from time to time they can do. Now, you don't have to memorize anything from those, but be aware from them. And if you want to go back and maybe watch this video again, write some of those down, and be kind of prepared. If you go in and the doctor says, I want to do this kind of a scan, you'll have some knowledge. And I think it's also helpful. Here's why. Do you know your doctor? Do you know he's going to validly prescribe something that's right for you? If you have some knowledge, you can tell him, you can ask him or her, is this the right thing? Because this is a little bit I know about it. You don't have to pretend to be a doctor, but just let him know you know a little bit, or she. And then maybe that'll even get you to a second opinion. That second opinion, frankly, might save your life. Who knows? Well, the final thought on this video, I want to go to a section in this research booklet. It's been a good one. I've gone through it completely. But here are the leading hospitals and health information organizations by how they were rated for heart disease, heart surgery by the U.S. News and World Report. Now, does that make them 1, 2, 3, 4, 5 just because the U.S. News and World Report said so? No, not necessarily. Go on to some other reports besides U.S. News and World Report. See how they rate them. But here's how this rates them. Johns Hopkins is number 4. No, number 1. But in another survey by another report organization, Consumer Reports or whoever, Johns Hopkins may be 2, 3, maybe even number 1. Here's the top 5. First of all, the Cleveland Clinic. My home state is Ohio, in case you happen to be from out of state when you watch this. And I don't pretend to have any connection to Cleveland Clinic. I've never been there. Number 2 is the Mayo Clinic. That's in Rochester, New York. Rochester, Minnesota, excuse me. My late wife and I were thinking about going there when she had her cancer, but she decided not to go. But I was getting reports from them consistently. A lot of good things from them. I also got some, I forgot to mention, I also got some reports from Cleveland. So I combined them with Johns Hopkins, and so I've had all 3 of these. Now, that's 1 and 2, and I said Johns Hopkins is 4. What's 3? Brigham Young and Women's Hospital. So if you happen to be a woman, listen to this is one you probably will want to always go to. And they're in Boston, Massachusetts. Number 5 is also in Boston, the Massachusetts General Hospital. Now there are others, and they list 10, and I'll just go down briefly, just so you know that there's 10, and they're listed here. The New York Presbyterian University Hospital in New York City, St. Luke's Episcopal Hospital in Houston, Duke University in Durham, North Carolina, Stanford Hospital in Palo Alto, California, the Barnes Jewish Hospital in St. Louis, Missouri. Now, the one in Stanford and one in Harvard are doing some studies on this virus that's sweeping the country, and they're coming out with some good things. So while this survey may be 3 or 4 years old, I don't know, or maybe only 2 years old, how they rated them. It could be older than that, and you might want to consider some other thoughts. But the point is simply that here's some good resources. Always check out who's doing what to your body and making sure. I had a surgeon who did this Whipple surgery, combined 3 parts of my insides, if you want to call them that, put them all back together, and that was July the 16th. I've not had a single problem from that surgery, none. Oh yeah, I haven't been as strong as I'd like to be, but frankly, that may have been more because I lost 60 pounds, and that was before the surgery. The oncologist I did, and I can't even pronounce his name, it's Ola Binga, whatever. We just call him Dr. Benga. He is Nigerian, a man of color. Now, this is incidental for many of you, but for me it was critical. I didn't know this when I agreed to have him treat me, but he was a Christian. He prayed with me every single time we met. And he said that this is one of the things that, not necessarily being a Christian, but being calm and thinking about things and having control of your mind that will really help you through a lot of these things. And don't be so nervous and upset, and have something you can fall back on. Yoga is probably one of the good things, although I've never done yoga. But Dr. Benga has just been so great, and I've had no problems with him. The doctor that was going to be for radiation was Dr. Karaba. I've talked with him 3 times, and he's been really helpful. I may go back to him and do radiation, we'll see. That's probably more than you need to know about me. But I wanted to let you know a bit about me, because here's a guy, me, that's given you 3 long, fairly long videos about a subject that appears that if I have any problems with, it's going to be well after I'm 80, because I'm already 80. And many people have them in their 50s. And that's heart attack prevention. And that's what this was all about. I hope you got a lot from this. I have others from Johns Hopkins. And I'm going to give these to you over the coming weeks. And it might be a month or 2 before I get to it. One of them is hypertension and stroke. Gets in a little more detail on those kinds of things about your inner workings, your heart, your blood pressure. And then your nutrition and weight loss, another one on that one. I'm going to see about getting some more of these from these research concerns and continue my research. But for now, that'll do it. Thank you for watching. I hope you've enjoyed it. Hope you've gotten a lot out of it. Go back and watch part of it, stop it, take some notes, and be able to be prepared, because it's your health. No one, other than maybe your extremely close loved one, is going to be more concerned about your health than you are. So God bless you.